Welcome back to today's video about children and kidney disease and what you can do if your child is going through kidney disease, kidney failure. We're going to reference some studies. If you're new to our channel, make sure to subscribe so you can stay on top of all the good information I do here to help support your kidney health. Today we're talking about children's kidney health. So as a parent, I can't imagine what that's like to have your child going through kidney disease. But what I would recommend, okay, if your child is going through kidney disease, get the opinion of 3 pediatric nephrologists. That's outside of any of this research I'm going to quote. Reason is we come across a lot of children with kidney issues here at Healthy Kidney Inc. Parents looking to support kidney health with diet, nutrients, things of that nature. And when I see a lot of the results and what comes in, a lot of things aren't being addressed. And this isn't new. This is like any other nephrologist. I talk about other videos about picking a right nephrologist, so you should at least get 3 nephrologist opinions. So let's get into some other stuff that came out in the last month or so. So a study here from Pediatric Nephrology, February 2022, evaluation of the relationship between serum carnitine levels and intradialytic complications in children with kidney failure. So these are children that were on dialysis, hemodialysis. And they were having complications like low blood pressure, cramping, and what they found was that a lot of these children had deficiency in carnitine. L-Carnitine is the full nutrient name. L-Carnitine is amino acids that your kidneys have a large role in producing and making. And L-Carnitine helps with energy production by taking your fatty acids and helping them go through the mitochondria. It's a little energy factory in your cells. So when you have kidney disease, there's a pretty high rate of carnitine deficiency. And in my time in this field, I've only seen one doctor, one nephrologist ever test for it. It's just not something tested. This is an over-the-counter supplement. L-Carnitine is an amino acid. Your body makes it from certain foods. You can buy it in supplemental form. So if your child is on dialysis, having complications, it's worth to try carnitine for a certain period of time. You can get it in liquid, pill form. There's a couple sport liquid forms, meaning they're for sports performance. Because L-Carnitine, you'll find it a lot sold for sports performance. You can use those as long as it doesn't have a lot of other bad chemicals and caffeine or anything like that. You can get pill forms, powder forms. With a child, you want to start around 1,000 milligrams. In that area, you can work your way up or decrease it depending on the response. But it may help some of those complications and side effects that come from hemodialysis in children. All right, so something to consider if your child is on hemodialysis and dealing with complications of it. All right, so we got another piece of research here. Impact of anemia on the cardiovascular status in children with chronic kidney disease. This is from the Clinical Nutrition ESPN Journal, Clinical Nutrition ESPEN, February 2022. So what happens is part of the heart, the left ventricular hypertrophy, so parts of the heart got larger. Okay, they didn't function well when there was anemia present in children with kidney disease. Anemia is bad for kidney disease, and there's still a lot of people, professionals, that don't pay any attention to it. If you have anemia and you have kidney disease, it makes all the heart complications that come along with kidney disease much worse. You're going to accelerate the loss of kidney function, so you're going to lose kidney function faster if you stay anemic for periods of time. So, and you're not going to feel well. You're going to have a poor quality of life. There's more cell damage, oxidative stress. So anemia, it has to be treated. There's a lot of safe irons. We have multiple videos on anemia, okay, and kidney disease. And that's why I really recommend seeing a couple professionals, a couple nephrologists when it comes to this, because one person may not address it, and I've seen it so many times before. And there's still the very outdated idea that anemia doesn't affect kidney disease, but it does. It affects the quality of life. It affects the kidney itself. It affects the heart complications, heart problems more and more if you're anemic. So if your child is on kidney disease, you may not know how to read the blood work. So check out our other videos and get the opinion of a couple different professionals. That's going to prevent you from one person missing it or not addressing it. Or that person's got hundreds of patients and he just doesn't have the time to think about everybody's case. He's just trying to manage medications. This is what happens in reality. This is what happens in practice all the time. Maybe the guy's or lady is going through a divorce, and guess what? Her practice is not going to be that functioning that well. She's not going to be thinking really about your game. about your blood work, what's going on with your kidney disease. So, multiple opinions. All right, what do we got? We got one last one here. Let me just flip the page. Potassium and fiber, a controversial couple in the nutritional management of children with chronic kidney disease. Pediatric Nephrology, January 2022. Dietary potassium and fiber intake are closely related but not associated with circulating potassium levels in pediatric CKD. So, if you just look at the recent video I talked about potassium, is that unless there's a problem, you don't want to restrict potassium foods. Don't have a lot of the potassium-rich foods, but don't restrict them because you're missing fiber, a key component to supporting good kidney health. And then you're missing all the nutrients, and then you're missing some little bit of potassium. You actually need a little extra potassium if there's kidney disease, but you don't want to go high out of range, so you miss out on some of these key nutrients. And what they're saying is the potassium, it's not a problem generally. It's not something you should avoid unless there's a problem in children that have kidney disease. So I talked about a few things, everybody. I hope this helps you. Check out our other videos on children with kidney disease. We have a few more. Even our other videos that aren't about children will apply to it. Do everything you can for your child. If they need that kidney transplant, then they need it. They can have a great, excellent quality of life, okay, if you're managing it and taking care of everything. From diet to proper medications to those multiple opinions to supplements. But thank you for watching, everybody. If anybody has a child going through kidney issues, my heart goes out to you, and best wishes. Bye.